Hi, I'm Cynthia Scheideman Miller,
And I'm Tiffany Johnson.
and we are consultants with Blue Cirrus Consulting. And we're here today to talk to you about telehealth documentation tips.
In today's short recording, we'll discuss some quick differences in documentation when it comes to virtual medical encounters compared to in-person care. We'll then finish off with taking a look at the verbiage we use in our documentation and ensure it's appropriate for our diverse patient population. One of the biggest differences in telehealth documentation compared to in-person care is making sure that you've documented that you have the patient's consent to proceed with a telehealth encounter. Patients may not understand just how much of a medical encounter we can actually complete virtually and may assume it's just a screening call or setting up an appointment. It's also important to ask the patient if they're in a comfortable private setting for the visit. This ensures patient confidentiality and privacy, both of which are components that the patient would expect in a regular in-person visit. It's also important to document physical exam findings like you would in a normal visit. However, it's crucial to document how those results were obtained. Did the patient palpate their own extremities and verbalize to you that there was swelling, or were you able to see it on the video? Is the patient verbalizing that they can hear and feel wheezing when they're breathing, or was the wheezing heard by you via a remote device? It's paramount to give context as to how you obtain those physical exam findings in your note for a telehealth encounter.
And you bring up a good point. The Office of the Inspector General recently cited billing telehealth services at the highest, most expensive level every time was an indicator of possible fraud and abuse, waste. But you can bill at the highest level if appropriate. But as you mentioned, Tiffany, you've really got to put a lot of detail in there, especially how you got those vital signs that to make it that you could bill at that higher level. Usually a remote visit is more like a mid-level coding, but still, as you just mentioned again, must be well documented.
Yes, exactly. Just justifying what we wrote down. So now we want to shift our train of thought to the tone of our notes. So often we're crunched for time while we're writing our notes that we don't stop and reflect on our writing before we're on to the next task. So it's important to be aware of biases that we may have and how they may come across in our writing. It's imperative to make sure that you're not painting the patient in an undesirable light for future healthcare providers to create a bias around in future encounters as well. So what I'd like to do is share a few excerpts of bad documentation and see if we can pick out what we would change. So our first example is Mrs. Smith is a 33-year-old female who presents with a chief complaint of blurry vision. She has a history of chronic hypertension, but is non-compliant with her medications and frequently utilizes the emergency room. So the way that this note is written implies that the patient isn't invested in feeling better and tells whoever is reading this note that the patient won't take whatever you prescribe or won't participate in whatever modality that you recommend. There are multiple reasons why a patient may be labeled non-compliant. It could be due to lack of insurance, financial reasons, or even adverse effects of the medication. So it's really important to document why they're being non-compliant rather than just labeling them non-compliant. Labeling patients as frequent ER users or frequent flyers is also a very aggressive label to use. It insinuates that the patient waits until absolutely necessary to seek care, and there are just so many other reasons that patients may wait until something is urgent. Our second example is Mr. Smith is a 20-year-old homosexual male who is seen virtually for a telehealth visit with a chief complaint of pain and burning during urination. Including the patient's sexual orientation as a core identifier in the initial byline is, also just incredibly aggressive. We wouldn't do that for a heterosexual patient, and writing like this could insinuate that the provider thinks that the patient is promiscuous or at fault for their chief complaint. If the sexual orientation is pertinent to the chief complaint, it could be included in the social or sexual history, but it's not appropriate to identify our patient like this. And just imagine if a patient was reading this in their chart. It could give the patient the impression that the provider was overly focused on their sexual orientation rather than what they came to be seen for.
So, Tiffany, you see patients over telehealth. Is there anything providers should consider about telehealth and the tone of their notes?
I think as we've all kind of progressed to being comfortable with this virtual workspace, we all know that, there's pets in the home, there's kids in the home. So if you hear a dog bark in the background, or if a mom has a baby on her lap that she's, trying to console during the visit, to just really have grace with their patients and understand that life's happening around them while they're doing this visit as well. So just really make sure that you're not voicing your frustrations in your note, no matter what you may have experienced during the virtual visit. So to conclude, I'll share a few tips on how we can prevent ourselves from inadvertently using stigmatizing language in our documentation. First, if you've had a particularly difficult patient encounter, take a deep breath before writing your note and make sure that your tone is professional. Second, think to yourself, how is this patient different from me? And am I making it a point to make that obvious in my note? This could include anything from race to sexual identity, like we had in our previous example, or even substance use. Third, be aware of situational circumstances, like I mentioned. Also, if you mention that the patient was aggressive or rude in your note, future providers reading that may assume that they're an aggressive person and treat them differently in a future encounter. The patient's mood isn't always a definite thing and may be a result of the pain that they're in or other life stressors that they're experiencing. So ultimately, just use your best clinical judgment to include anything that's pertinent to the patient's social history without using it in a stigmatizing way.
Those are all great tips. Thank you for your time today, Tiffany. And for people watching the video, if you have more questions, please reach out to us. Here's our contact information. We would love to be of help to you, and have a great day.